everyone, and welcome to today's Elemental webinar, where we're going to be talking about water efficiency in healthcare settings. NHS figures suggest that the health and care sectors cut water by 21% between 2010 and 2017. But healthcare facilities are still looking for ways to improve efficiencies. Technologies such as low-flow taps alongside water leak detection and greywater recycling are just some of the water efficient solutions that are being used. And this webinar is going to look at the potential approaches to reducing water use in healthcare settings that ensure successful outcomes for patients, staff and stakeholders. So we've got a great panel here today, including Tom Reynolds, who's the CEO of the Bathroom Manufacturers Association. We've got Karl Mansfield, who's Water Awareness Ambassador and Customer Water Awareness Advocate at Water Plus, and Philip Tamuno, who is the Joint Head of Sustainability and Net Zero at Barts Health NHS Trust and Barking, Havering and Redbridge University Hospitals NHS Trust. So hi everyone and welcome. We've got a few talking points to get us started, and then we'll be taking questions from the audience. So audience, please feel free to put questions either into the chat box or into the ask a question box below. We will try to get to as many questions as we can, but we will be sticking to an hour today. So let's kick things off. Water is something of a secondary consideration when it comes to sustainability, often behind things like carbon and energy, but they are closely interlinked. And for healthcare action, this can be a real challenge because water is so integral to everything the sector does. There can't be any compromises when it comes to ensuring there's enough water for hygiene, cleaning, medication, patient use, and so on. So Karl, let's start with you. Is water on the radar for the public sector? And would you say there are any common denominators between those giving it more consideration than others?
Hi, yeah, thanks, Rachel. For those who don't know, Water Plus, we're a water retailer, so we work with customers across England and Scotland, including in the public sector, including some of the NHS trusts and so on. What I'd say is awareness is certainly growing amongst energy and sustainability managers in the public sector around the important role that water can play in helping not only manage running costs, but also helping towards the green plans that are in place and the overall NHS target on net zero. What many don't realise is even changes in site use, so more people using it or less, which we've seen over the last few years, can have quite a difference to how water use has happened and been used over the time. And looking closer at that and tracking that more closely can help find the opportunities and benefits from it, as well as using some technology fitted on water meters such as data loggers, which can really give up-to-date readings every single day, taking readings every 15 minutes and uploading it onto a portal. What we noticed was we actually commissioned a survey back in 2019 around water attitudes for public sector workers. It was a survey of 500 employees. And although it was 2019, so a couple of years ago, it was pre-pandemic. And what was interesting back then when we asked through this independent survey company was 70% of public sector workers in England and 62% in Scotland said their employer could do more to encourage them to reduce their water consumption while at work. And when we asked what resources were they encouraged to reduce or recycle and think more about at work, only 27.5% in England and 21.4% in Scotland said water. So that was behind paper, plastic, glass, energy and food. Which more respondents said they're encouraged to do. So our thinking is those attitudes are still there and the willingness of the employees is still there, as well as all the visitors that go to the sites as well. And I think COP26 and all the other events we've had in the last year and a half have really raised awareness amongst people across the public sector and the visitors to those sites around water and other natural resources that we're using as well.
Great, thank you, Karl. Philip, how have your trusts approached this broad requirement that you bring water consumption down?
Thanks, Rachel, and thanks, Karl. I think the main thing I'll give an overview of three different organizations, 2 NHS and 1 university. I think the deregulation of the partial deregulation of the water sector opened up lots of opportunities. I think that's the first start. I think that, as well as COP26, and the NHS Green Plan and Net Zero target, So those became key factors. So across East Midland Ambulance Service, their priority was, okay, let's look at what we currently use. It wasn't significant, but we'll look at the wider impact on climate change as well as drought impact. Across Barts and BHRT, what we've decided to do is to look at our baseline. Where do we use water and across different areas? So it's early days, but our priority is to identify where we can have easy wins. I use the word easy wins because we can't just benchmark our water use based on GIA, the gross internal area of buildings, because some of our buildings will require more water use, our catering services, as well as our dialysis unit and other hydrotherapy pools and other areas. So it looks simple, but it's slightly complex. The other aspect with water is the volume and the spend is actually not that significant, but the passion across Barts and BHRT makes it a significant aspect. So the main reason why I said I'll talk about another organization is I'll talk about Queen Mary University of London. It's the same thing. I recently joined both organizations 3 months ago. Within the next 2 to 3 months, what I intend doing is to carry out a detailed water efficiency survey. So when I did that at Queen Mary University, we're able to identify easy wins, areas in which we can make those significant difference. Simple things like the urinary system. Some of them just fills up and flushes. Those areas have less impact on patient, less impact on IPC. And across the NHS, if we have to get it right, we have to get all stakeholders on board. So apart from identifying the baseline, is who are stakeholders. The key stakeholders are infection prevention and control colleagues, because they are very fundamental to that. We have standard we have to meet regarding CQC. So within healthcare setting, it's a little bit complex, but if we get it right and get every stakeholder on board, we'll get to where we expect to get to, which is our net zero by 2035 for our direct emission. So that's where we had Barts and back in Havering, Redbridge University Hospital NHS Trust, but there's still a long way to go. Hopefully within the next couple of years, we'll have more case studies on some innovative approaches. I know we have some currently, some simple flush in which you just, rather than touch the tap, it automatically flushes. But the challenges we have is we have not been able to quantify those benefits and those savings. So what we're looking at, apart from just investing, is to be able to communicate the benefit of all the little things we have done across our system.
Great. Thank you very much, Philip. Moving on to Tom. Tom, in your position as CEO of the Bathroom Manufacturers Association, do you have any sight of whether healthcare facilities are looking into water conservation in any degree? Is this interest growing quickly enough? What are your thoughts on this?
Yeah, thank you, Rachel. Well, we recently formed a healthcare and adaptation special interest group within our members, because they are clearly suppliers into NHS and wider healthcare estates, and there are several kind of issues affecting those particular members and their relationship with the NHS that we're looking to support. The government in this year's Health and Care Act enshrined the net zero target for the NHS into legislation, and it won't come as anything new to the audience of this webinar. The 3-year Green Plan talks about transforming the healthcare estate and the impact on climate change with an ambition of achieving net zero by 2040. To do that, estate managers are going to have to look at water, pure and simple, both in terms of the Scope 3 emissions from the supply and the processing of potable water, but also the Scope 1 and 2 emissions that are associated with heating water. A more efficient, water efficient healthcare estate is a more carbon efficient healthcare estate. Is interest growing quick enough? I think that's a really tough question, but let's kind of take a step back and look at the wider context. Up until recently, Sir James Bevan, who's CEO of the Environment Agency, has been talking about the jaws of death of an 8 billion litre a day water deficit in 2050. And it's not an abstract concept of water scarcity. It's something we've experienced this summer with 40-degree heat and a drought leading to hosepipe bans across the country. This is an effect of climate change which is being experienced right now. There needs to be kind of big investment in supply infrastructure and reducing leakage, of course. But as one of the biggest landlords in the country, the NHS can do more to reduce its water demand consumption. Approximately 50 billion cubic litres of water used by the NHS every year. That's something which can be tackled, but it needs to be tackled quickly.
Okay, thank you very much, Tom. So let's talk about water conservation in practice. In theory, it should be relatively straightforward with the right technologies, things like dual flow flush and low flow taps, leak detection equipment. Tom, which technologies do you think have the potential to have the greatest impact? And could you perhaps even talk a little bit about the potential of water reuse?
Well, yeah, I think the first thing to say, and this touches on something Philip was talking about earlier, is that good, safe, clean water is absolutely paramount to efficient healthcare, and it's therefore the first necessity whenever we're considering how to configure the water fittings on an estate. It's vitally important for patient care. It's vitally important for infection control, and that's the first and foremost consideration. However, there's new digital innovative products like smart juicy flush taps, which can significantly reduce water use. The digitally connected products can alleviate the need for manual duty flushing. At the moment, the NHS through duty flushing to ensure that there's no chance of waterborne pathogens like Legionella entering into a dangerous space. Duty flushing is something which tends to be taken place manually, but that can be conducted even in high traffic areas where there's frequent use, and therefore the duty flush is unnecessary. With a digitally connected smart duty flush product, actually it takes into consideration what the actual use of the product has been, so there's no need to do that manual flush as when necessary. There's lots of other products coming on stream, like toilet flush valves that require less maintenance than traditional drop valves, for instance. There's plenty of leak prevention products which perhaps haven't got the penetration into the marketplace that they could have already. And the sector's innovating all the time with new products coming to market. And I suppose the duty on our sector is to communicate that those products are now available to the estate managers. And that's really the reason why we got this group together.
Sure, okay. Karl, what kind of response are you seeing to these technologies? Do you find that some appeal more to customers than others? Are there some that seem perhaps too complicated or too daunting for take-up in this sector?
I think there's a number of things. I mean, both Philip and Tom have covered about the managing the Legionella risk is really, really important. You know, we can't underestimate that element of it. So whenever you're looking at low flow or water efficient taps, which we generally use the phrasing here, it's important to know your water network and how it uses water, what the flow rates are like, what the pressure is like, and so on. So you really do need expertise in there to have a look when you're installing these sorts of things of people who've done these jobs before and can do them safely and properly for the organisation, using things like RAS approved water efficient kit out there, which is the sort of the standard to reassure people that it's clean, safe water coming through those elements which are added in. In regards to what customers are looking at and what organisations are looking at generally in our area as a water retailer, certainly some are installing data loggers on the water meters, and that can track the water use more closely, providing information on an online portal, so that can help. And I know I've mentioned that before, but it is quite an important one because you don't need to go around reading all your water meters. Some of the water meters may not be that easily accessible. You may not have that maintenance routine to be able to access them every single week or every single month, or as much as your reporting standards are needed. So it's a really good way of doing that. And you can also set alerts and parameters for those alerts. So if there's any unusual usage, it lets you know straight away. So there isn't a delay of a week or a month or longer to see your data. you can get that alert really quickly to jump on any issues that might cause potentially supply to stop to certain areas of a site. Again, really important for a hospital and any other healthcare site to keep up and running, especially at the moment. So it's really important to have those bits in place, and there is interest growing in that area. We certainly do work with customers to install the data loggers on there. Making sure your flow rates are at the relevant level, as I said, to make sure that Legionella risks are covered off. And also, whenever you're installing these water efficient devices, it's always important to make sure there's enough flow through the pipes as well, so the water can be taken away through the wastewater network to be treated and so on. And it also, as long as the flow rates are enough through those pipes, it stops things like blockages and build-ups on sites as well. So you don't want that, preventing either water supply getting to a certain area or worse, causing pipe leaks or joints to burst on the system. And that's why regular site pipe maintenance is really important, as well as a system for staff and visitors to highlight issues they see at a building. So reporting to facilities teams, energy teams, however the systems might be, depending on your setup there. And the other thing to be aware of, we did a SNAP survey earlier this year around the importance of regular site checks. And we found that 92% of people from the private sector and the public sector who completed the online poll said they wouldn't know if there was an underground leak at their organisation. So that really sort of drums home how this water can be seeping away, which would cost your healthcare site quite a lot of money. It may be only a few pounds, or depending on which area you're in, per cubic metre of water, which is 1,000 litres. But actually, that 1,000 litres adds up to a lot if it's running 24 hours a day, 7 days a week for the whole month as well. So it's really important that you're on top of those things, as well as the energy elements of it. And as Tom referred to, if you use less hot water through water efficient taps, you have an energy saving as well. So you have a lower cost saving for that. So things like water efficient shower heads, for example, they can drop flow rates, which means less hot water and less energy use overall. So there's different ways of doing it while still meeting the strict and right parameters there to make sure that patients and staff and employees at sites are all kept safe as well.
Rachel, could I just come in on one thing that Karl said around
Sure.
the kind of approval of fittings for the setting? I mean, of course, RAS is the very well-known approval scheme, which is present in the marketplace. But actually, the important thing is demonstration of compliance with Regulation 4 of the water fittings regulations, and there are numerous options which specifiers need to be aware of. RAS is one of them, but there's also Kiwa Reg 4 certification. There's 2 NSF schemes as well. And really, all of those schemes have a great level of currency in the demonstration of compliance. So that I think it's important that specifiers understand that there are multiple documentation which you might be presented with. I also neglected to answer your question, Rachel, about the issue of water reuse. There's some great opportunities in the domestic setting around using greywater to flush sloughs and potentially in the future recirculating showers as well. I think we've got to be careful about implementing those sorts of technologies in the healthcare setting. You know, as we've said and we've laboured before, first and foremost has got to be in mind patient safety, and it's right that there's a high bar there, and that might prevent some of those water reuse technologies from applying in this setting.
Okay, great. Thank you, Tom. So, Philip, whilst we're on the topic of technologies, I know you've mentioned a few that have been used in your trusts already, but could you perhaps explore or share with us any sort of particular successes, challenges, or lessons learned you've encountered from implementing these technologies?
Thank you, Karl. Thanks, Tom and Karl, for your contribution and for understanding and highlighting the challenges we face in the health and care sector, because most times people just come in with ideas, okay, can you implement A, B, and C? I think regarding I'll talk about the opportunities first. I think the health and care hub, just like Tom spoke about, is a key driver. We have responsibility. There's also regulatory drivers. the water fit associated with water fitting to ensure that we don't have leakages. So those are fundamental responsibilities that we know we have. I will consider the chat because patient have, that's why we're here, to ensure that we get it right. So what I tend to look at most from experiences, let's look at areas that are away from patient areas. It's always easier for us to just look at stuff and say, okay, those are easy windows where we have more water use. But as I said earlier on, the areas of efficiencies, let's look at where we use water across our catering services. How can we have more efficient taps? How can we ensure that they are not non-defective taps? So sometimes the challenge you tend to have is jobs could be logged for the defective tap, but it will take longer. What I've decided is to flip it on the other way around, apart from just looking at the volume of water that is being lost, to have a compliance register that include water efficiency and regulatory compliance as a key issue. And then the other opportunity is, I know I spoke about the deregulation of the water sector. As NHS Trust, we have to get involved with partners that, apart from just delivering water services, are also involved in water efficiency and water reduction. So those are areas, those are opportunities that we currently have. And then the third option, the other driver we have, which is great, is the NHS Net Zero target across both trusts. We have significant passion for that. So looking at the backside, I know, just like Tom said, talk about greywater harvesting in the NHS would not be a good option. But we can also look at rainwater harvesting, where we have gardens, and to water gardens, where it doesn't have to affect patient. If we have residential accommodation within our estate, how can we ensure that we have to design those effectively? And then the other option is with construction and new build, and that is where we can easily make and refurbishment. There's some little things. You look at taps. I'll just give you a typical example with Queen Mary University when they refurbished and retrofitted a building which is called Department W. That's a perfect building. What do we have? Instead of having taps, we then have, I know previously dishwashers were taken off. Just reintroducing dishwater made the building more water efficient. Instead of washing dishes one after the other. So there's some simple things we can do, and that significantly resulted in significant reduction of water wastage. I won't say water use. And then, as I spoke earlier on, have systemizers that are effective for our urinary system. Most of them are just set as standard. Sometimes I know some areas are not used 24/7. How can we have sensitive systemizer rather than for us to have wastage? So those are simple technologies we can implement, but we should also be open for new technologies and try them in restricted areas. We need significant monitoring. For any new technology that comes into the NHS, we have to try it in particularly for water efficiency. Energy efficiency is easy, but water efficiency, we have to carry out some trials, ensure that it meets patient safety requirement, infection prevention control requirement, as well as quality. So the technology are there, and then the most effective technology is behavioral change. That's just the main thing. There are things that we expect staff to do. It's just, can we get it right to ensure we don't waste water? And those are the basic things. Sometimes you have some simple taps, what do you call it? Boilers are automatic. You just use it for your coffee and tea. That has saved significant amount of water. By the end of it, some people say, no, I need my water to be boiled by kettle. Let's get rid of those kettle, because you have one, energy wastage and water wastage as well. So you have those are simple technologies that we already have around. We have to promote and shout about those simple technologies and those simple improvements we have had. Sometimes you have water taps that I just said that you can use rather than. So it's for us to have those implemented. Apart from just water wastage, I also link it up as we are aware during the summer, it was really, really warm. Because most systems don't have cold and hot tap, what do we have to do? Most times we have to order water. Apart from looking at water as an issue, we also look at water packaging. So it's a massive issue. So regarding adaptation, just like Karl Tom spoke about, we should look at the bigger issue, water use across our estate, and see that as part of our climate change duties.
Great, thank you very much. Yeah, we are going to come back to the idea of conceptualizing water in a wider context in a moment. First, though, I wanted to ask a question generally to you all. So anybody who feels like they have anything to contribute here, please jump in. We've been speaking about water consumption measures inside healthcare facilities, but we mustn't forget that in a lot of healthcare facilities, the external grounds of these buildings are important too for staff and patient well-being, for a positive contribution to nature and the biodiversity of local areas. So, and this also tags into a question that somebody's asked in the chat about rainwater harvesting. Does anybody have any insight then on the ways that outdoor water use can be managed? Perhaps any technologies or strategies to ensure that outdoor areas are maintained, but without wastage involved?
If I could come in on that one. I know we've spoken a bit about the sustainable drainage stuff for inside the buildings, but actually if you look at sustainable drainage on the site-wide area, so outside the buildings, there are some simple steps, like Philip was saying, it doesn't have to be really complicated, some of these things. Some of these solutions are there. It's just think about managing the grounds. So for example, reusing rainwater for watering the grounds, for example, if that's needed, or any grounds maintenance stuff. It still needs to be kept correctly when it's been collected as rainwater and safely and so on. But with more and more NHS sites looking to improve green canopy for health and well-being reasons and so on, planting more trees and shrubs, look at more water efficient or drought resistant plants and shrubs that you're putting in, for example, which would need less water. So all of these things can actually reduce the amount of tap water that you're using, because the tap water is stuff that is at the highest quality to drink and used for other things, for cleaning and so on. You don't need to use that on plants and grass and so on. And as Philip said, an extremely hot summer that we've had, the grass bounces back. We've all seen it in the last month. It went brown, it went yellow, but it bounces back. We don't need to flood the ground with water. And actually it can cause issues with surface water flooding if you're putting a lot of water into really dry, compacted soil. And things like tree planting as well. Sites could look at planting trees within contained boxes as well to manage root structures. But also trees can also help manage surface water as well. Now, obviously, you need a lot more expertise around that area to see what might be best for your site. But those are sorts of things that are quite simple in a way, but could make quite a difference over a year, over 2 years, particularly because, as Philip said, NHS budgets, it's like a business, it has to be run really efficiently and every pound spent has to really count. So it's about thinking about the biggest impact and where you can get the shortest payback. So those are some of the things that I'd say to have to think about and to consider. And certainly our advanced services team here, they've worked with a number of sites around looking at how water use is in the building and throughout to see what sort of solutions could happen. And there's lots of different solutions out there as well, as Tom's been alluding to throughout this webinar already.
Yeah, I'd agree with Karl. I think in a lot of the most water efficient commercial buildings and indeed domestic properties that are out there, then water reuse is for irrigation is forming a key kind of strategy to get to where properties need to be. I think we've got to be really, really clear in healthcare to draw that distinction between rainwater harvesting and greywater reuse for public health reasons, but there's certainly some big opportunities. The other thing I'd say is on water efficiency rather than on SUDS, is that there's nothing to stop you looking beyond the boundaries of the property to achieve, say, water neutrality through working with water companies in the local area to retrofit to achieve a water neutrality standard on your site if you're building a new property and so on. So you can look beyond the building.
That's great. Thank you.
Right.
Philip, is there anything that you'd like to add there about external water use and perhaps experiences you've had with your trusts?
Yeah, I think the only thing I'll add is, just as we see with this topic and every sustainability, like the groundwater use, we need a grounds and garden team, and that is fundamental, so that we understand the type of plants, the type of trees we plant, and the requirements. Sometimes if they don't know what is required, you can, just like Karl spoke about overwatering. So it will bounce back. if I'm not an expert in that area, my God, he said, our grandson garden looks so bad. But if you have an expert there and have that level of engagement, and look, these are the issues we have, and get their input as well as their ownership and leadership. We did that at Queen Mary. We had a grandson garden team that did exceptionally well. They understood the kind of things we have. They ensured that we have wildflower meadows, which they felt require less water to manage. And when they planted shrubs, they ensured that those are managed in a more efficient manner. So we had biodiversity enhancement as well as water efficiency. So in summary, we need our grandson garden team on board, as well as whenever we have any new technology and we look at biodiversity. Biodiversity is fundamental for health and well-being. So ensure we are able to capture everyone on board. So those water we use, we should be able to account for them. Some cases we may not be able to harvest rainwater, but we should be able to demonstrate the long-term benefit of those water. So it doesn't look like a waste, because at the end of my God, yeah, we don't have rainwater, but we're using tap water to water. They also have widespread benefit for the environment as well as for our estate and patient and staff.
That's great. Thank you, Philip. So we've been touching on this here and there throughout the throughout the webinar. As well as these physical technologies, a lot of water conservation achievements are going to be driven by behavior change and upskilling. So let's start with Karl. This is going to be a challenge, right? Because medical staff, they just want to get on with helping patients, and patients just want to get on with getting better. So perhaps water is not necessarily going to be at the forefront of their minds on a daily basis. I mean, how would you suggest that this is approached?
Yeah, I think it's a really interesting one, the behaviour, not only of employees, but how decision makers are reviewing their sites and how water is used. Just going back to the survey that we did in 2019 of public sector workers, 31.6% in England and 16.8% in Scotland were aware of formal performance or reduction targets around water at their organisation. Now, that might surprise people and say that's actually quite high. For 2019, it's hopefully higher nowadays, particularly with the encouragement of all the hand washing over the last 2 years. But there is a willingness amongst employees and visitors to the site to do more around this sort of stuff. So we're working with NHS Stockport NHS Foundation Trust at the moment around some water efficiency education materials for their employees, as they have a green plan currently. So we've got water leak checklists and some different materials that they can use in their various communication strands as well, because they want to focus a lot more on water efficiency. But as Philip says, doing some of those small steps initially around taking the kettles away or not filling up the kettles full each time. I'm sure we've all done that, whether we've been at home or at work. You don't need to fill it up all full. That is an energy and a water saving there straight away. And I think also there's something on all of us to share some of the savings data further afield as well. So Philip is doing some great work there at the Trust. Some of those simple savings of what sort of difference does it make to energy and water bills. I think we all have a responsibility on us with the UK's target for net zero to actually communicate that a bit further afield as well. So that's what I'd probably say on those points. And the other thing is, Tom referenced earlier on, is don't forget that water is in scope 3 of your emissions. So your supply chain is in scope 3, so is water, but it can impact on 1 and 2 depending on how you're heating the water, whether you're using energy or gas. We as a water retailer, we can provide information and extra data through the data loggers around water use, which can really help the sites manage that. There was a question in the chat about water companies doing more around reducing leaks. I think it meant at sites. Now, sites, whether you're a business or public sector, your water pipes are your responsibility, as they would be as a homeowner as well. So if you have a leak on site, it's on you to get it repaired as quickly as possible. And any cost associated to that leaking water will be in the bills. Now, as a water retailer, we include all the wholesale costs for the water in our bills. Every water retailer does that. So that is a charge which doesn't move. What I'd say is there are also additional measures to be aware of that if you don't fix a large leak quickly, there can be extra things that can happen to make you fix that leak very soon, and it can cost more money as a result of that. So what I'd say is just be aware of the regulations in the water market. We've touched on the water quality regulations already, that Tom covered off nicely with the Legionella risks and so on. But those are things really to be aware of, because you could be forced to do a leak repair at short notice, which could cost you a lot more than if you'd have been aware of it a few months back, and didn't have to rush into that job. But certainly our view is the employees, the staff, whether they're the cleaners, whether they're the nurses, they can all help with all of this. They're doing a fantastic job and they've got lots on their plate, but they ultimately all want to do good for the patients that they have, and they also care. You know, these people have joined this profession because they care, and our research, independent research, indicates they care about the environment as well, and about how we use natural resources as well. They're not someone who just turn up to work and just don't care about how they use water or energy. They do.
Okay, great. Thank you, Karl. Philip, you've mentioned a few times now in your experiences of water efficiency in your trusts how important it is to get people on board, and how you've engaged with a number of different teams, and they've been really present and engaged. How is this something that you've approached, and do you find that there are any specific challenges in particular departments or particular areas?
I think training is fundamental, and awareness. I know some colleagues have already raised the issue of UN SDG. I decide to respond to it when we get to this stage of the discussion. The fundamental is what is available to us, what's available out there. The Institute of Environmental Management and Assessment have bespoke courses I've used, and I found them very effective. I've been a corporate member of AIMA at it's about, for NHS Trust, it's 2,500 per year. It gives your staff access to 10 staff access to become affiliate members of AIMA. They will have access to webinars, free training, and then it also gives you, if you have individuals that are able to deliver AIMA's courses, you can also become a training center, which I've done. And the environmental sustainability skills for the workforce is a very good course I've delivered. I delivered, well, as at Queen Mary University, I delivered it to over 160 staff across the university, as well as partners across London Borough, Tower Hamlet, and other AIMA partners. So the issue is, what is that course about? It's about green skills, about knowledge, about empowering staff. It's not about telling them what to do. It's empower them to understand the mega trends, the key environmental issues, whether it's water use, energy use, biodiversity, waste management, resource use, so that they can bring climate change, they can bring everything together. As part of that course, you also look at issues like the UN Sustainable Development Goal. That sustainability, water use is not just about water and the environment. There's also the social aspect. I found that very useful, because at the end of the day, most of those staff that attended the course became our environmental champions, and they moved on to becoming key individuals that promotes event. The last water efficiency campaign that I did at Queen Mary before I left was written by someone that attended the course. So by transferring that responsibility, it's not just about the sustainability team leading on this agenda, it's by empowering colleagues to move the agenda to the next stage. And what I've decided, that's why I tend to do is understand where we are. So I joined in July. So by 1st April, I'll roll out the same course. That the issue is not just rolling out the bespoke course from the Institute of Environmental Management and Assessment. I'll adapt it to make it fit for purpose. At the end of the course, they have 7-hour CPD certificate. The certificate is just part of it. The staff will be empowered to apply that. The benefit with Barts and BHRET is that we already are passionate staff. Since I joined, okay, what are we going to be offered? So those that offering are there, we can just get that. Those opportunities are available. The other aspect is sometimes you can have staff that are very busy. How can we unpack that? Instead of having a full day course, you can unpack that and make that fit for purpose. When you have national awareness campaign, I know next week is, I know we're talking about water, but you have recycling campaign next week. How can you unpack that and make it fit for purpose? We have to engage with colleagues. And then the feedback loop is also very important. Because sometimes when you have awareness campaign, okay, I've finished. There's always, whenever I deliver those courses, there's always actions for me. And I find it really good, because it's okay, these are the challenges we have. How can that be fixed? So you have to work on the system and ensure that you get everyone on board and share the benefit. and get everyone involved in the awareness campaign. It's not just about you that is a sustainability professional, because each professional has a role to play. So that's my approach, and I found it very, very effective.
That's great. Thank you very much, Philip. And
Rachel, if I could just come in on that, on Philip's last point. One of the things that we found really effective is getting organizations to speak to their employees for ideas. What are the simple things that you're seeing? Or, that tap's been running for about 5 years. Well, let's get it fixed then, or why can't we get it fixed? And just find some of those kind of shop floor ideas as part of that engagement process and empowering process can really, really help make a difference for water, but also other elements like energy and so on.
Yes, absolutely. I think that's a great point, Karl, is actually engaging everybody across the business. And often, the people that are making these decisions and driving change don't necessarily have the shop floor view that many employees do. So, Tom, we'll just end with you before we move to the questions here. We've been talking about behavioural change. Obviously, that's going to be a critical component of water conservation. But technology itself is advancing. As you say, it's always innovating. Will we get to a point where actually human intervention will be negligible, and that technology, will just make it as efficient as possible for us without any human effort involved?
Well, I suppose the ultimate in engineering, and for my members in product development, is that they're able to produce fittings that save money, save energy, and save water without any need for human intervention. So if we look at showering, that involves designing shower heads that deliver an equal level of performance to current expectations, but with perhaps a lower flow rate, or more to the point, a lower total water use per showering event. The toilets, it's a lower flush volume system that clears the pan every time reliably. Even with the contribution of better engineered products and smart products, unfortunately, I think there's always going to be an element of behaviour change involved. I think someone in the chat put around a 4 litre per minute tap left running is still going to be an inefficient tap, and that's quite right. And another example I'd give is those smart duty flush taps, which I mentioned earlier. If the cleaning staff and the estate staff haven't had training and know that these products have been installed, and they continue to do the manual duty flush, obviously the saving is wiped out straight away. An even more base level, let's look at dual flush toilets. There's some research out there, there's conflicting research to be fair, but there's some research out there that says that not everyone understands how the typical dual flush toilet button works. Well, if as estates managers, we need to provide some nudges to ensure that the user understands those dual flush buttons, then we have to do that. So I think it's certainly some things that manufacturers are striving towards, lower and lower levels of human intervention, but that's going to take time, and sadly when it comes to water efficiency and energy efficiency, time isn't on our side, so we're going to have to intervene and nudge behaviours, certainly.
Great. Okay, thank you, everyone. So those are our talking points. We're going to take some questions now for the next 15 minutes. We've got one here from Christian Taylor Hamlin, who asks, does the need for risk mitigation in healthcare significantly slow down the potential to decarbonise? Who's got thoughts on that?
Let me come in. It's an opportunity rather than a risk, because we need clinical transformation. We need to change the way we do things. We are aware of that, but because of the risks involved, we have to get it right. And we can get it right by having the right individuals in the right place. You have energy efficiency, those that have experience, those that understand what the CFC requirement is. We use Chartered Institute of Building Service Engineers, and engage with the key stakeholders rather than just come from an energy point of view. That's why I spoke about the mega trends. Everything is linked. to get everyone on board. It doesn't slow down the process. Where the process slows down is when we work in silo. Previously, sustainability professional just comes in and they just want to deliver A, B, and C. They want to switch off light rather than look at the lighting requirements. They just want to reduce heating without taking into consideration what we have to deliver, which is comfort for all staff. Those are fundamental to health and well-being of staff. So as soon as we start looking at the big picture, it helps us to deliver what's expected. Then behavioral change becomes effective. Because everyone knows, yeah, I'm there for my patient. You have designed a ward that is fit for purpose for my patient. The kits we have installed are slightly more expensive, but they're more energy efficient, and they can go the other bit. You have more efficient lighting system in place. Some of them you may not have PRR installed, but that consultant or that chief nurse that is leaving that office, that theater room, or that surgical area will automatically switch the lights off because we have engaged with them. So I see that as an opportunity rather than a risk. That's my opinion, though.
Tom, Karl, anything to add to this?
Yeah, well, it's something that I'll chip in. I think that was a good answer, Philip. I'd add to it that it's really important that we kind of don't lose our corporate memory and what we've learned over the years as we kind of move forward on this agenda. And something which I've been tracking closely is some concerning comments around, for example, thermostatic mixing valves, which I know isn't an issue for water efficiency, but the reason why they were included in the HTMs and are widespread in healthcare is because years ago an alarming number of patients were suffering from scalds as a result of water temperatures not being right. So TMVs have got a very important place in the healthcare setting. But I fear, looking at some of the social media coverage of this, that some of that corporate memory has been lost. So important that we don't fall into the same trap in other areas of fittings management and water management and the healthcare estate.
And the only thing I would add, following the really good points by Philip and Tom there, is do seek out additional expertise if you need to. That there's no harm in asking questions, seeking more information. There's a mention in the chat about knowledge management systems and how information is being spread beyond the public sector to healthcare, to schools, to private sector. We as a water retailer, we have a lot of information that we put out on our website, on our social media, but also one of our remits is highlighting water efficiency to raise awareness about the possibilities out there and what you could consider and think about. You don't need to do it all at once. Small steps can really make a really big difference when it comes to water efficiency. But doing those things and thinking that way and seeking out some of that information, which is in the public domain, whether it's on the Bath Manufacturers Association website, whether it's on UK government websites, there is information out there. Sometimes it's just knowing where to look, but ultimately just seeking that reassurance of expert advice if you're going to install anything or anything along the lines to make sure it meets those compliance and health and safety requirements which are in the healthcare.
Thanks, Karl. Okay, question here from Catherine. Are you aware of any technologies that can make healthcare staff their working lives easier, as well as saving water?
Well, at the risk of sounding like a broken record, Rachel, that smart duty flush and digital connected taps would be a good example, which I'd highlight. Leak detection that works, which again is digitally connected and can alert facilities management to reactive problems, can assist in reducing the proactive check burdens on them. So they're two examples which I point out.
Great, thank you. Anything to add there, Karl or Philip, at all?
I think just those kettles that are already there. It's the same thing. It boils water to 100 degrees. It doesn't make our coffee taste differently or our tea taste differently. It's just for us to go with the trend. It to deliver what's expected. So, and it doesn't add any. It also keeps Regarding space management, it creates more space for us and less to do regarding part testing and equipment testing.
And the only thing I would add is that, really knowing your site portfolio is really, really important when it comes to energy or water or anything else. Knowing how it's being used, how has the volume of people on that site changed over time? It may be that you had pumps to pump water on at your site to a building that used to be 4 stories and is now 2. So just have a look at those sorts of things, because there can be measures which can happen in the background so that the staff are saving water straight away, but also that reporting structure, not only the data alerts through data loggers for water meters and any other reporting systems that you might have, but also encouraging that leak reporting system as well. Now, we all know that some taps and so on can't be fixed straight away due to other elements which need to be fixed on the pipes first, or due to the priority list, or due to budgets. But that reporting system should flag any of those larger issues which are more visible a bit quicker, so that can help with the prioritization of repairs and management of the water system as well.
Okay, great. Another question here. Feel free to jump in, anyone. Does line scale reduction play a part in water and energy efficiency projects? Anybody like to jump in?
I thought Karl was going to jump in there. I'll say something briefly. I mean, we recently, within the last couple of years, did extensive work with Thames Water around the issue of leaky loos, where in so many cases we saw that line scale had corroded the parts of the valve, which then created a leak, and just the most minor kind of build up of detritus around the bottom of a drop valve can unfortunately cause some level of water loss. So unquestionably, that is a big area where line scale reduction can make a huge contribution to water efficiency.
And thank you, Tom. No, I mean, to me, it comes back to the point about regular maintenance and checks. Making sure that all of your fixtures and fittings are in good, efficient working order. Making sure there isn't a trickling leak in the toilet, for example, which Tom will be aware of. These can waste hundreds of litres a day. I think 600 to 800 litres a day we've seen on some sites. So it's really important to be aware of those smaller things that might be a slight hissing when you walk around a bathroom or something like that. And you think, oh, where's that coming from? Having a look for those sorts of things and doing those regular checks is really, really important.
Great, thank you. Okay, so I think we've got time for one last question here. And this is mentioned a couple of times in the question box, which is sustainability goals and reporting against them. So I suspect this is probably a question for Philip. Are you updating NHS HTMs to align with sustainability goals?
So the HTM is, sorry about that, it's generally updated by NHS England and NHSE, but as individual organization, we have their responsibilities. Sorry about that. We should be aware of the UN Sustainable Development Goal. We should be aware of the wider sustainability agenda. I know the net zero is a key aspect, and that's why I tend to do when I came back to the NHS 3 months ago. They say, look, yeah, we have the net zero, but there are other issues. Biodiversity. Why do we have the Queen Green Canopy? Those are fundamentals. So ability to capture that and even report that locally. So sometimes we don't have to wait for national adjustment. That's why if we don't have the skills, just like Karl spoke about, no single individual should be able to have all the answers. It's for us to get individuals in that will help us unpack that, particularly the social aspect. If you're not very good, you can get someone to unpack the social aspect. We know we have ESG, environmental social governance, to ensure that that is appropriately integrated. You are local, you know how you can fit that in. So what's fit for purpose for one trust may not be fit for purpose for another trust. So that's for us to ensure it's fit for purpose and it adds value. We may look at the ESG, just like understanding the baseline. When Karl said we have to understand the baseline, look at ESG and say, wow, that looks good, but that won't fit into our organization. So we may not be able to address all the aspects, but for us to demonstrate that sustainability addresses all issues. I know someone said, if you take care of the staff will take care of the environment. As sustainability professional, there's a little we can do. We can't save the world, but there's what we can do to contribute to it by ensuring that we integrate the UN Sustainable Development Goal when we look at issues. Make the just like I don't want to re-emphasize myself. Make sure that any sustainability intervention we introduce are fit for purpose. They don't result to staff being unhappy because staff are already working long hours to deliver best possible patient care. Let's not talk about adjusting temperature down that makes staff start complaining that where they sit, where they work from are not comfortable. So let's look at easy wins, or not easy wins that will be universal and will be appreciated by everyone because we're part of this system.
That's great, Philip. Thank you. And you make such a good point there. There is no single person has all the answers to this. No single person or organization has all of the answers to this issue. And that's why webinars and knowledge sharing like this is so important. So that is all the time we have for today, everyone. Thank you for joining us. And thank you especially to our speakers for their really useful insight on this increasingly important consideration for the healthcare sector. So this webinar will be available to view shortly on the Elemental website. And if you're not already, please do follow us on LinkedIn. We're Elemental UK for all of our latest updates. Thanks very much and have a great day.